Hello, everybody. Welcome back to Cannabis Reality. This is Robert Head with Him for Victory. Join me today. I'm talking with Dr. Blair. Dr. Blair is a West Point graduate, graduated from the University of Miami with his MD, and retired as a colonel. For the past decade, he's been studying cannabinoids and understanding how it works with the body. Today, he's going to join me and talk to me a little bit about why is it that when cannabis enters into the veteran's life, a pill reduction is seen. So sometimes we see, for example, a vet may be using cannabis and go from 14 pills to 4 pills a day. So why is that? Today he's going to tell us. All right. Welcome, everybody. This is Dr. Philip Blair is with me today to talk about the cannabinoid system and the body in regards to how it affects you and also how opioids affects the body as well. This will tell us a lot about how and why veterans are moving to cannabis over their prescribed opioids. Dr. Phillip, please describe to us what's going on in the body when someone's taking an opioid.
Well, when somebody takes an opioid narcotic it goes right to the certain opioid receptors that are contained with the body, both peripherally and centrally in the brain. And when it goes there, it attaches to the opioid receptors and it gives an analgesic effect. And that's fine. Now, these opioid receptors are located mainly in the brain, is where we're focused on. But they're also related to peripheral tissues. But in the brain, these particular centers where the opioid receptors are also co-located with cannabis receptors, as a matter of fact, except in the brainstem. And so opioids are connecting with these opioid receptors, they're activating them, and they're giving us analgesia.
But when I'm having cannabis, I tend to lose the pain, but my mind isn't really focused on the pain, it's focused on other things in my life. Whereas when I take the opioid, I lose that focus on other things. What's going on with when we take cannabis? Why is the cannabinoid system reacting so much differently to it?
The cannabis is acting on a number of different receptors, including the opioid receptors in the body and in the brain. And so by acting on these other receptors, it increases our different connections to our body and to our mental status. It improves our cognitive function. It allows us to connect with our fear and modulate our fear and control fear and anxiety. And so we're in a much better state and more cognizant, more aware of what's going on. It actually enhances the sensitivities to a number of different feelings that we have, both sensory as well as emotional. So it's a full balanced effect from cannabis. The number of receptors that the cannabis connects with are huge. There's about 6 or 7 that it actually connects with that make it a very, very effective, and multiple connections make it very effective for controlling pain and controlling emotions. Robert, one of the biggest problems with taking pain medications is that there's a depression that is often associated with it. And so often veterans are coming in not just because of pain, but because of depression and maybe PTSD, but there are other symptoms that are going on. And cannabis addresses all of those symptoms beneficially. So it relieves the anxiety, it relieves pain, it relieves many of the fears that we have, the anxiety, and it controls for the physical function as well. So that with PTSD, we get an activation of the endorphins, the excitatory chemicals that go into cortisol, and it runs our heart rate up. But the cannabis actually controls for those things, those physical functioning that's going on in the body, to a great benefit.
Is this why we see when someone's taking cannabis, and let's say they're on a 10-pill regimen a day, that over a period of time they go down to about 2 to 3 pills?
We're right, exactly. Because the cannabis is treating all of the symptoms of treating depression and anxiety, it's treating the physical functions and the physical pain, but it's also treating the emotional problems that go along with it. And it's treating depression very specifically. And so a great benefit, and you can reduce the medications that go along with it. So often medications are used as an antidepressant is added to the pain medication, and then something to relieve the episodes of side effects from the opioids or from the antidepressants. And so this is cascading of symptoms and prescriptions becomes very high powered and excessive. And so they're put on a number of different medications, whereas cannabis actually targets many of these symptoms very specifically.
From a professional's point of view, when you have patients, what do you think the medical community in general, when I say medical community, I'm talking about all general physicians, everything. What kind of, knowing what you know about the cannabinoid system, how should they approach patients with our newfound knowledge of holistic medicine?
Well, that's a very important question. First of all, they need to know about the endocannabinoid system. They need to understand that it integrates within all body systems, and that it has very valuable benefits all over the body. And then next, they need to realize that besides cannabis, there are other compounds that they can use that are endocannabinoid modulators, things like terpenes, things like palmitoyl ethanolamide, which is actually an endocannabinoid, things like curcumin and echinacea. These are valuable modulators of the endocannabinoid system, including omega-3s. Omega-3s have quite a value in pain reduction, as well as modulating the endocannabinoid system. So they're very powerful tools that can add to the benefits. Whereas opioids by themselves have a depressant effect. They can put people into depression, and they're associated with depression. They're also there's anxiety-related issues, and actually opioids in a chronic basis can lead to a sensitivity to pain in the long run. And so the benefit for chronic pain syndromes is really highly questionable.
With marijuana and cannabis in general having such a low fatality rate, nobody's died from it. The overdoses are next to none. Does it make sense to use this as a maybe a base to figure out where medication really needs to be per patient? Because a lot of times we see medication people are taking medication they don't need, but there's no other options for the doctors to prescribe something. So would introducing cannabis as maybe a platform where we can kind of judge, okay, well, how severe is your actual pain? Do you really need these pharmaceuticals? Can you manage everything holistically so that we can find out how to really solve the problem?
Well, first of all, opioids actually work very synergistically and very well with cannabis. And so cannabis in combination could be a way to orchestrate a beneficial plan and limit the amount and mediate the amount of opioids that are required. By combining the two, you can get an excellent benefit, and you can treat acute pain with the opioids, which is well accepted that it is effective for acute pain. But for chronic pain, that's a problem. So combining opioids with cannabis could be a very effective strategy for determining what the needs for opioids are. And combining it would actually reduce the rates of tolerance and reduce the cravings for opioids completely. In fact, some studies have shown that it eliminates the withdrawal effects. It eliminates the cravings, and there's no subjective drug dependence on opioids when cannabis is used. So it's a great benefit. If providers if they could understand and they could partner with somebody who they knew had good information about cannabis and had a knowledge of cannabis, and they were trained in cannabis, then they could apply these things very effectively. Now we're talking about cannabis, but there's medicinal cannabis comes in varieties such as cannabidiol, and cannabidiol and and other and opioids have been very effective for controlling pain as well. So we don't have to think of just cannabis. We can also use an isolate or a blend with a very low amount of THC, and people can get extraordinary benefits from a combination of those things. In fact, one study actually combined CBD, cannabidiol, with beta-caryophyllene, which is a common component of hemp. And they found that it provided analgesia to a broad extent, but it actually was effective at activating the cannabinoid type 1 receptors, and which is amazing because there was no THC in the product. And one of the things we don't think about is how that effect could happen. It turns out that both these substances, the CBD and the beta-caryophyllene, actually inhibit the breakdown of the endocannabinoid substances. So it actually upregulates the endocannabinoid system for an overall better effect on the body and for analgesia as well as mood enhancing capabilities.
That both there needs to be a balance between good medicine and good natural medicine. So where does that start? How do we start breaking this this devotion to pills? I know this is not something that Big Pharma wants to hear, but as a society, we need to break this marriage to Big Pharma. And how do we balance the two? Where does that start?
Well, that's a challenging question because of the indoctrination that conventional physicians have, and their negative aspects of cannabis that has been growing on to us for so long, and that has been part of the just say no to drugs phenomena, and its inclusion in narcotic derivatives as a narcotic substance. So, getting away from that particular function is going to require some really strong changes. I consider that functional medicine is a very realistic approach to these problems that veterans are encountering. And functional medicine looks at the cause of the problem primarily and addresses those particular problems with the best herbal or medicinal substances that are available. And I think that's where we need to go. And I think it's going to be a long time coming. It's going to require tremendous education programs for VA physicians and for other medical professionals to accept it. But I think that that's the direction that the world needs to go, and especially American medicine.
That's true. And VA is a teaching school, so it'd be pretty prominent to start there. Dr. Blair, thank you so much for coming on. I want to give you an opportunity to talk a little bit about your website and what all you do too. So give yourself about a few minutes and tell us a little bit about Dr. Blair, where you're from, and what it is that you do, because you've helped me out a lot too.
Well, thank you, Robert. I appreciate that. So I'm a veteran myself. I went to West Point in 1972. I graduated in 72, and I went to I trained in family practice at Fort Gordon. I spent a career in the military and as a combat physician as well. And I retired in 1996. From there, I've been doing mixed jobs, but I became very much aware of CBD in 2014, and I started doing my education and training, and I was devoted to CBD. Now, recently, I found in the last 3 years, I found that an effective component of hemp is actually with beta-caryophyllene, which provides many of the benefits of CBD and actually THC. And it doesn't come from hemp. It actually can come from a number of different vegetables, including there's over 1,000 plants that harbor the beta-caryophyllene. And so it's of terrific value. It connects with, it's actually a phytocannabinoid that connects with the CB2 receptors, which are your non-psychoactive receptors in the body, but they control all immunologic function, and they can regulate the inflammation in the body, and they provide analgesia that way. So in the combination of beta caryophyllene and CBD have been superb and synergistic for a number of different benefits. So at my website, blairmedicalgroup.shop, we offer a selection of beta caryophyllines and cannabis in different modes and different concentrations. And I've been treating patients with these combinations for about 8 years now.
That's outstanding. Dr. Blair, thank you so much for coming on. I really appreciate it. Always a friend of him for victory. Whenever we need somebody with a subject matter expert, you're the guy that we like to turn to. We really appreciate you coming on and talking to us today.
Thank you, Robert, for having me.
Talk to you soon.